Maddie.
Hi.
I am going to go over the aligner wear and care instructions with you. Everything that you will be seeing that we are going over is going to be in this start bag here that is provided for you. So the first thing I'm going to go over is how to keep the aligners clean. There are a couple different tools that we give you that you can keep the aligners clean. The first thing we give you is a travel toothbrush here, and this is really great for being able to clean the aligners. Now, when cleaning the aligners, you can use just a normal toothbrush and toothpaste. You can also use antibacterial dish soap as well. You can just place it on the toothbrush or just use regular toothpaste. It's very important to take care of keeping the aligners clean and keeping your teeth clean as well. So when it comes to the aligners, you're going to be wearing them for about 20 to 22 hours a day, all the time. You will remove them when you eat or when you drink anything that's not clear liquids. You will remove them. So water is fine, but if you are going to have anything that is sugary or that is colored that could stain, I would remove them.
Okay.
Just because you don't want it staining the plastic.
How often should I brush them and clean them?
You should be brushing them and cleaning them after every time you eat. So as soon as you are done eating, brush your teeth and then go ahead and brush the aligners and put them back in. Okay. So to clean the aligners, you want to get the inside of the aligner, and you also want to clean the outside of the aligner as well, just because as long with the inside, the outside can get kind of icky too. You are going to be wearing each set of aligners for 1 week, and then you will move on to the next set. If you look closely here, all aligners have a number on the tooth.
Okay.
So if you ever get confused about what number of aligners you are on, it's always on the aligner. Switching them out every week and wearing them all the time is really important. Also, keeping the aligners clean is important as well, and you can just keep them clean. We give you a travel toothbrush, and you can use either toothpaste or antibacterial dish soap. Brush the aligner, the inside, the outside, brush your teeth as well, and then you can go ahead and put them back in, okay?
Okay.
We also give you a couple of cases. We give you a hard case, and we give you a soft case as well. And why we give you two is I think it's important that when the aligners aren't in your mouth that they're in a case. That way you don't accidentally lose them. I've seen sometimes patients put it in a napkin when they're eating and that ends up in the garbage, or sometimes pets like to get a hold of them. So just make sure when the aligners aren't in your mouth, they're in a case, that way you don't lose them.
Okay.
We also give you a nail file here. We polish the aligners, but sometimes there can be a spot that can be bothering your gums or can be a little rough on your tongue. And this nail file is really good for just going ahead and buffing out any edges that may be bothering you, okay?
Okay.
We also give you this aligner cleansing foam. This is really good for when you are on the go and you don't have access to a toothbrush or toothpaste. What you can do is you can go ahead and open it, take the cap off, you go ahead and you pump a little bit of the foam into the aligner, and then you can go ahead and put it back in. You don't need to rinse it, but the excess will come out when you push it up. Each aligner is programmed to move your teeth a little bit differently. So each pair of aligners, it's gonna feel like a brand new pair of shoes that you're gonna kind of have to break in. Your mouth is gonna have to adjust to it. So these are aligner seaters, and when the aligners are in your mouth, you'll go ahead and slowly chew on it, kind of like a piece of gum, and move it all the way around your teeth. This is going to make sure that the aligners are seating properly, and it'll get rid of any rockiness that might be there when you first put the aligners on. So in the bag provided here, there is an aligner tip sheet. This goes in part with the Clenchy. So before you move on to the next set of aligners, I want you to take time and just take a look in the mirror, make sure that the aligner that you are currently wearing is fitting correctly. If you notice here, you can see that this tooth right here, that aligner is seating all the way, that tooth is fitting nice and snug in the aligner. But if you look here, you can notice that there's a little bit of a gap in between the tooth and the aligner. That means that aligner isn't seating all the way in that area. And if that aligner is not seating all the way, that means it's not moving your tooth the way that we want it to, okay? So if you are to notice the gaps, what you can do is you can go ahead and stay in that aligner for an additional couple of days and really work on the clenchy in that area, okay?
Okay.
A couple of things can cause gaps in between the tooth and the aligner. If you're not wearing the aligner for the optimal amount of time, and if you're not doing enough clenchy, that can also cause gaps as well. Just make sure that you check before moving on to the next set of aligners that the aligners you are currently wearing have no gaps and they're fitting all the way.
So even if I'm not experiencing the gaps, should I still use the Clenchy?
Yes, sometimes there can be small gaps that isn't visible to the eye. If you don't see any gaps, you don't need to do the Clenchy as often as you would if you are to see the gaps.
Okay.
All right, so during the first week, it is normal to experience some discomfort when placing the aligners in and out, especially might be a little tender. Also, as we begin to move your teeth can become sore, so you might want to stick to softer foods for the first week. Mac and cheese, oatmeal, ice cream, smoothies, those kinds of things are going to feel great on your teeth. Okay. When your teeth are sore, the last thing you want to do is to eat super hard foods like carrots or bread, that kind of thing you can stick away from. Okay. As well as talking with a lisp is going to be normal for the first couple of weeks. Okay. As your mouth and your tongue gets used to having that plastic in there, that will slowly go away. The first week is going to be kind of the biggest adjustment period. It is normal for every time you put in a new set of aligners too, to have a little bit of discomfort for the first day or two, but it's not going to be like it was during the first week.
Okay, should I take medication for the discomfort?
You can take Tylenol or Advil, whatever you have at home. Read the directions on the bottle and follow the instructions on the bottle.
Okay.
We are super excited for you to start our journey with us. If you have any questions or concerns, you can email or text us. If one of the attachments is to come off, if you were to lose an aligner, or if you have any questions about the aligner, definitely don't hesitate to reach out to us, okay?
Okay, thank you.